Hello everyone, I'm here today with Alfonso DelAguia. Did I say correctly?
You did.
Yes. So he was born and raised in US, and we worked together in the same dental practice. And he was also accepted into Boston University Dental School, where he's gonna be doing the regular DMD program for 4 years. And I would like to make him some questions because he understands a little bit better about how the process work in the US, how to get licensed, how to go to the regular DMD program, and also about titles after you graduate. And the first question is, first of all, thank you so much for accepting the interview. And you can talk a little bit about yourself and why would you decided to do dentistry?
Yeah, so of course, I was born here in Massachusetts. I was raised about 30 minutes south of Boston. And I went to high school in a small town called Westwood, about 25 minutes south of Boston. I went to college at the College of the Holy Cross. It's located in Worcester, Massachusetts, about an hour away from Boston. When I first entered college, I was pre-med. I wanted to become a physician. I had no idea about dentistry, and then one day I got matched up with an alumni from my school who is a dentist. And so my initial reaction was dentistry. I don't really want to do dentistry. But then I shadowed him. He's a prosthodontist over at the Dental Partners of Boston, Dr. Michael O'Toole. And just shadowing him, I would say, was an eye-opening experience for me. I realized how beautiful dentistry is, how personal it is, how one-on-one you are with the patient, how quick the results are, or how quick they can be with big treatment cases. And that really made me interested in dentistry. So.
Nice, you sound so passionate about
Yeah.
So the second question is, what is the pathway of a DMD, a regular DMD program for Americans or whoever went to high school here and all of that? And then after finishing their high school, what is the process like to get into dental?
So the path to becoming a dentist here in the States, it's kind of a long one, I'll be honest. So after you graduate high school, you have to enroll in a four-year undergrad university or college. And in those schools, you have to take a certain amount of prerequisite courses in order to apply to dental school. In my personal experience, I had to take biology 1 and 2, general chemistry 1 and 2, organic chemistry 1 and 2. I had to take a calculus course. I had to take a English literature course, and I had to take a psychology or sociology course. And then after you complete those prerequisites, you have to typically take the DAT test, which students either take when they're in college or after college. The DAT is short for the dental admissions test. They examine the students in a variety of natural sciences, so biology, general chemistry, organic chemistry. They also have a section for reading comprehension. They have a section called quantitative reasoning, which is just basically mathematics, like algebra, geometry. They have a perceptual section to it, which is where they give you basically shapes, 3D shapes, and they give you a set of scenarios saying, will this shape fit through this keyhole, or can this shape be folded in a certain manner? And then there's also I think I covered all the bases with the DAT. And then in my case, though, after I completed my four-year undergraduate degree, I went to a master's program in Rutgers, New Jersey, just because I felt like I needed a more stronger base in the sciences. So I enrolled in a Master of Biomedical Sciences, where you essentially take courses along medical and dental students and PhD students. In my experience, I took courses along dental students such as oral immunology, oral microbiology, anatomy physiology, stem cell biology. And those courses really prepare you well, just because you're taken along with dental school, medical school faculty, and the students. And I did well in those courses, which I really felt prepared me for where I am today. So it is a long path, but yeah.
So how many years that would take? That would be 4 years for undergrad, which is college, plus 4 years of dental school. And in your case, you also did
a master's,
which was
about a year and a half.
A year and a half.
In my experience, 9.5 years.
Oh wow, that's a long, long time.
Yeah.
One question, a question that so many people ask me on my Instagram is, what is the difference between DDS and DMD? Because it's a little bit confusing and we don't have that difference in Brazil. So could you explain a little bit for us what that means?
So essentially, whether you have a DDS or a DMD here in America, at the end of the day, you're still a dentist. The only difference in those two titles is just the name of the title. It depends on the institution that you go to. For example, I believe Harvard was the first dental school in the country to award a DMD, which is short for Doctor of Dental Medicine. Prior to that, typically schools gave out DDS, which can either stand for Doctor of Dental Surgery or Doctor of Dental Science. But ultimately, whether you're a DDS or DMD, you can still practice all of dentistry. It just depends on the school that you go to.
So both DDS or DMD confers you the title of general dentist.
Correct,
right?
after graduation.
Sounds
Yep.
good. There is no difference between them.
Nope.
Cool. Another question is that it's very confusing for me, and I would like to understand a little bit more, is about the fellowship programs. Can you explain to us a little bit what that means?
Yeah, so let's say you do a postdoctoral specialization. Let's say you want to decide to specialize in prosthodontics here in America. After you complete your 3-year prosthodontic residency, you can do what they call a fellowship here. For example, in prosthodontics, you could do maxillofacial prosthetics, which could be a 2 to 3 year training, additional training, typically at an academic institution or academic hospital, which basically gives you additional training within the field of prosthodontics, but in something that's a little bit more, I guess you could say, niche or subset of prosthodontics. I know in oral surgery, for example, you could do a fellowship in craniomaxillofacial reconstruction, or you could do a fellowship in orthodontic surgery. So of course, all of those aspects of those fellowships fall under oral surgery, right? But they're specific subsets or niches within the field that people want to, put an emphasis on in their practice. And then you also have, you can become a fellow of a dental society.
That's another thing.
That's a whole different thing. When you become a fellow of a dental society, it's more, I guess you could say, it's more recognition of you as a clinician. Typically, it could be for your clinical expertise, for your contributions to the field of academics, research. It depends on the society that you get invited to. Sometimes you have to apply, sometimes only by nomination or invitation. For example, if you become a fellow of the International College of Dentists, I believe that one is by invitation or nomination only. But there's so many societies out there. It really depends. Each society has their own
particular way to admit somebody.
Correct. For some societies, it may be that you have to complete a certain amount of continuing education courses or hours. Some societies, it really depends on the society, but yeah.
That makes sense. That makes more sense now. Thank you. How many years? No, that one I already asked you. What is the average salary for a dentist in the state of Massachusetts?
Yeah, so let's say if you're a general dentist, it could really depend. I guess you could say that a big matter in deciding how much money you make could also come down to the types of insurances that your office takes. For example, let's say your office takes private insurances like Delta Dental, Guardian, MetLife. Those insurances typically have higher compensation fees for the procedures that you could do compared to a public insurance like Mass Health or Medicaid. Typically, those public insurances reimburse the dentist at a lower rate. So ultimately, you have to work more in order to make as much compared to if you only took private insurances. So a lot can go into it, but I guess let's say you're at a busy office, you could start off making $200,000 annually in a successful practice.
And then the specialists, they make a little more.
They can make 300,000, 500,000, even $1 million if you're a multi-practice owner specialist. So it really depends.
Nice, very good. So what other degrees a dental student can pursue?
Yeah, so following their training, either in the 4-year or 2-year AS program, a student can specialize within a field. If you decide to specialize at a school like Boston University, let's say as an example, endodontics, you can get the title of CAGS after completing your 3 to 4 year residency program. That stands for Certificate of Advanced Graduate Study. But let's say you want to elongate your training at BU or another school, let's say like Harvard. let's say you want to, instead of doing a 3-year program, you want to do a 6-year program, endodontics or orthodontics or whatever, you can end up getting a doctorate degree. A doctorate degree, for example, a doctorate of dental science degree, orthodontics or prosthodontics. I would say those degrees are typically more for people who are more academically inclined, people who want to do research, maybe teach at an institution.
Yeah.
So ultimately, if you decide to do those paths, you kind of become a double doctor. You know, you become a doctor of dental medicine, but then you also become a doctor of dental science. You know, but at the end of the day, it really depends on the school that you go to. Ultimately, I know Harvard offers masters of dental science degrees in each specialty. I believe at BU for oral surgery, they offer certificate of advanced graduate study too. There's a doctorate program there too, which is maybe probably 6 to 8 years compared to the conventional 4 to 6 years.
Oh, that's a lot.
Yeah.
And also, if you want to pursue a career as a specialist, you can also attend to 100 hours of, let's say, continuing education courses and get those titles at a fellowship program, right?
Correct, yeah. For example, I believe to become a fellow of the American College of Dentists, you have to complete a certain amount of CE hours to even apply. They probably do have other requirements that you need to do in order to apply. But if you do become really involved in the field by either teaching CEs or attending these CEs, you can definitely become a fellow. I believe there's also a society of implantologists where you can become a fellow of that society as well. I'm guessing you have to take a certain amount of implant CE courses, truly show that you're dedicated to the field of implantology. So
that's very interesting.
A lot of titles out there.
I know, it's a whole world to understand and also to get involved too.
Yeah.
Thank you so much, Alfonso.
No
I
problem.
appreciate your time.
No problem.
He got accepted into Boston University and then to the regular DMD class. And then we're gonna be seeing each other every day in school.
We will be.
Yeah.
All right.
Yay.